Well, I'm Dr. Japa Volchok. I'm the Vice President of Operations for Vohra Wound Physicians. I started working with Dr. Vohra about 8.5 years ago as a general surgeon and vascular surgeon in the Northeast providing wound care. After working for several years as a wound care surgeon in the Northeast, I moved to South Florida and took an active role as an executive with the organization. Currently, I oversee our revenue cycle, our legal affairs and risk management, and our payer affairs. So I started in the healthcare industry, ironically enough, not in human medicine, but actually in veterinary medicine. I pursued undergraduate and actually started veterinary school before I decided to transition and pursue a traditional medical pathway into human medicine. That really came about after I studied abroad for a semester in Thailand and realized that I was looking for a career and a life path where I would make more of a direct impact on someone's life as opposed to an indirect impact through perhaps their pet or their farm type of a veterinary medicine. And so that really led my decision to pursue medicine and then eventually general surgery and vascular surgery. I attended Worcester Polytechnic Institute for my undergraduate degree, where I majored in biology, and then I attended the University of New England for medical school. After medical school, I pursued residency in general surgery in the University of Massachusetts system, and then pursued vascular fellowship at Eastern Virginia Medical School. A lot of the work that I do with our physicians and with our patients is to enable them to understand better what it is that their insurance is paying for, what their insurance requires from the physician in terms of documentation, and for patients, making the bills or statements that they receive something that's easily understood. Healthcare is one of those areas where there's not a lot of transparency into what is charged for a particular service from a hospital or from a doctor's office, and insurance companies are not always the best source to understand what it is that's been billed, what's being paid for under the insurance benefit, and what's not. And one of the areas that I've worked with in the organization is to try to make it much more straightforward for a patient what it is that they've received for their services, and also for our physician what it is that they're being paid for and what it is that is expected for them when they render a service. One of the topics that sometimes is a term used in healthcare is healthcare numeracy, and that basically is a type of literacy or understanding around the numbers in healthcare. And this might be something as simple as the doctor telling you that you're going to take 500 milligrams of Tylenol or another medication for your fever, or it might be something as complex as meeting with a physician for your lung cancer diagnosis and understanding the options for chemotherapy, and the physician talking with you about the probability of recovering from your cancer. Being able to understand those types of number nuances is numeracy or healthcare numeracy. The same type of numeracy or understanding applies to a patient statement or an understanding of an explanation of benefit that you might receive from your insurance. And it is something that is not always clear when perhaps an insurance says the doctor billed $500 for this particular surgery, we're going to pay $200, and then there's the leftover amount. And as a patient, you may be left wondering if you're responsible for that, either a portion of it or all of it. And something that we are doing here at Vohra is trying to make that much more understandable for patients and clear. Because healthcare is one of those areas where transparency in the billing and the insurance coverage details is not always readily apparent, at Vohra, we are trying to make healthcare more transparent for patients and deliver a higher value to both the patient and the payer. There is a definition for value-based healthcare that is used commonly, and that is what the outcome that matters to the patient is and the cost for that outcome. And so to deliver high-value care, you have to be delivering care that is important to the patient, is efficacious for the patient's condition or problem, and is also something that's conscious to the cost and the inputs into the problem. One of the items that I work on quite a bit here at Vohra is to partner with our payers and our insurers to create models for payment that are value-based. And under those models, nutshells, what we are doing is we are partnering with our payers so that the patient's care and their outcomes and their wound healing is directly linked to payment for those services. This is in an effort to deliver a high-value care to a particular patient and do that in a way that's cost-conscious and cost-effective. We are committed to quality outcomes for our patients, and we have had several years of experience in which we know exactly what a particular patient's course of care may be on average and what that cost might be. And in partnering with payers, we're able to achieve not only the best clinical outcomes for patients, but do that in a manner that is the most cost-effective. For patients that are suffering from a particular disease process, it's oftentimes confusing. You may get conflicting recommendations for different things. And one of the things that the Vohra physicians are trained to do and do very well is they partner with the facility and they take a team approach to care so that they're sitting with family members, they're talking about the disease process, they're talking about what the best treatment is, they're talking about alternatives to treatment, and they're involving an entire team approach to it so that everyone is hearing what the plan is and what the message is, and there's not perhaps one particular person in the room that maybe has a higher level of understanding. You know, typically interactions between patients and physicians are one where the physician tells you blah, 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 and you walk out of the room and really don't have an understanding or an idea of what it was. Maybe you caught a small part of it. And so taking that team approach and involving others in the care gives a patient, you know, additional resources to say, hey, afterwards, you know, what was that the doctor said? Did you understand that? And have an opportunity for different avenues back to the physician to have questions answered.